Well, I'm so grateful that you came here today. We met just, was it 2, 3 days ago?
Yeah,
We hadn't seen
for
each other in a long, long time.
8 years. Yeah,
And you came because you had some serious health concerns that were kind of mysterious in nature in terms of trying to figure out where does this all come from, right? How we're going to
exactly.
handle
Yeah,
this
yeah,
and how we're going to tackle this in a way that's most efficient, right?
hmm
And cost effective. And I suggested to you the Trudose method, the
yeah.
Trudose Protocol. And we're here on day 2 of the test drive slash training in my office where we've been treating patients yesterday all day and then today. And I'm glad you agreed to come and
Yeah,
give this treatment a try.
yeah.
Would you share with us your experience?
Well, I will say on my drive down today, I just was, it was just tolerable to get here. I couldn't wait to get here, and because just different pain issues, and so now that I've had one treatment, and I can't find the pain. It's not there, and the doctor tells me, well, don't don't think that that's just a coincidence. It's this is what we're doing, and
Yes.
it's pretty convincing. And I've been watching films here today of other testimonials that were very impressive, and previously, a couple days ago, when you had me here and showed me the video, uh, it was it made a lot of sense to me.
Mm-hmm.
Uh, I didn't know anything about that. I had no knowledge that these things could occur, but I was convinced just by watching the film,
Mm-hmm.
and now having the actual personal experience. I'm actually amazed.
Yes, and you had this treatment less than a half hour ago, right?
That's about right. Yeah, yeah,
And I'm happy to say that you're not the only patient who's experienced some significant shifts even while in the chair before leaving the office.
yeah.
So it's been very, very impressive to me.
You were interviewing one of your patients out in the other room, then I couldn't quite hear, but I could tell there's a happiness, and there's improvement, obviously.
Yes.
So um, that was impressive as well. He's a very old man. Very. I saw him the other time too. He was here
Yes, yes.
just a couple of days ago, and yeah, he's probably looks to be 20 years older than me, but not today. He's got a big smile on his
Yeah,
face,
definitely.
and the doctor I was talking to said, "Oh, he's a very happy man today, and he can't stop laughing." So,
Yeah.
yeah,
So I'm very excited to, well, first of all, that you were able to get this treatment today,
yeah. Thank you
and
very much.
I am becoming more confident that there's many other patients in my practice that have been struggling,
Hmm.
and surely there's others right here in the community that they're looking for a solution and have not yet been able to find it.
Absolutely.
But the beauty is that this can be integrated with any other treatments that patients might need, whether it's nutrition, whether it's herbals, homeopathics, ozone, laser.
Yeah,
But in your case, I think given how far away you live from here and given some other factors as well, I think it made a lot of sense to try this first.
well, I'm glad we have. I'm excited about going. With that. I've just been. I run my own business, and the pain was getting so bad that I couldn't proceed.
Mm-hmm.
In fact, there were 2 days last week that I had to just take off, and I don't do that.
Mm-hmm.
I've been working 50 years, almost 7 days a week,
Yeah.
and you know, I do a lot of my own maintenance for myself around the house,
Mm-hmm.
and different things, and I just never stop.
Yeah.
And but this has stopped me, and I'm very excited to think that I can. I want to have more years of feeling good, and being
Definitely.
able to produce.
Yeah. Of course, you're young at heart, young in mind, and just your body wasn't cooperating.
That's it. I was telling a friend the other day. He said he's my age, 2 months younger, and we were talking, and I said I had this as a youngster. I was mowing lawns as my business. My early teens, 12, 13. And so I was at the gas station filling up my 2.5 gallon can for 60 cents or something, of high octane gasoline for my mower. And so this fellow comes riding in, a European guy on a European bike, extremely healthy looking, looks like he's got to be 70 at least, And I'm thinking, that's me at that age. I've had that image all this time. Now I am that age, and I was not quite as good a shape as he. But I had also collected another image off of a TV program where they were showing the oldest people on the planet.
Mm-hmm.
And there was this one guy, 104 years old, in one of the countries. And he would leave home on his bicycle, ride downhill to the water side, where his friend had a restaurant bar type situation there. He'd play cards, drink a little wine, have lunch, different things. About 4 o'clock, he rides his bike back up the hill, and they documented this. Perfect. I got my next image, my next goal.
Yes.
Yeah. So.
Wonderful.
Yeah, that's where I am.
It's very emotional,
Very
huh?
emotional about it.
Yeah.
Yeah. Because I was not able to do.
Yeah.
Just yesterday, I did a fair amount of work. I was on my feet a lot of time, but as soon as I got home, man, it's just like, whoa, hard to handle.
Yeah.
Pain that would make your nerves. You just can't believe I'm going through this torture.
Yeah.
And it would be short term, but it'd be repeated over and over, during the day, and I got to find a solution. Yeah. I think maybe I have. Let's see.
Yes.
Yeah.
Well, I'm very excited for you.
Thank you.
With this wonderful result, almost instantaneously.
Yeah, fantastic.
And we'll be following up tomorrow, day 3 and day 10. That's our routine. Okay. And then 3 weeks from now, we'll have a Zoom meeting where everybody will be sharing their experiences.
Very cool. Okay.
Yes. So thank you so much for sharing your experience.
Thank you, Doctor. Yeah.